Introduction. In the previous chapter, we had studied about the values for total dietary fiber and the diseases caused by their deficiency. Nutrition or nourishment is the supply of food materials required by organisms and cells to stay alive and is utilized in an organism's metabolism, which must be taken from its environment. They are used to build and repair tissues, regulate body processes, and are converted and used as energy. Nutrition also focuses on how diseases can be prevented or lessened with a healthy diet. Nutritional diseases are diseases in humans that are directly or indirectly caused by a lack of essential nutrients in the diet. They are commonly associated with chronic malnutrition. We had also focused on obesity, that is caused from overeating, which can also contribute to serious health problems. Let us now have a look at the diseases caused by deficiency of different vitamins, which are also a very essential and unavoidable nutrient.
Let us see at the history of vitamin A deficiency. Vitamin A deficiency is a lack of vitamin A in humans. It is common in developing countries, but rarely seen in developed countries. Night blindness is one of the first signs of vitamin A deficiency. Xerophthalmia and complete blindness can also occur since vitamin A has a major role in phototransduction. Symptoms. The prevalence of night blindness due to vitamin A deficiency is very high among pregnant women in many developing countries. Vitamin A deficiency also contributes to maternal mortality and other poor outcomes in pregnancy and lactation. Vitamin A deficiency also diminishes the ability to fight infections. In countries where children are not immunized, infectious disease like measles have higher fatality rate. Even mild subclinical deficiency can also be a problem, as it may increase children's risk of developing respiratory and diarrheal infections, decrease the growth rate, slow bone development, and decrease likelihood of survival from serious illness. Treatment. The treatment of vitamin A deficiency can be undertaken with both oral and injectable forms, generally as vitamin A palmitate. High dose vitamin A supplementation of the lactating mother in the first month postpartum can provide the breastfed infant with an appropriate amount of vitamin A through breast milk. However, high dose supplementation of pregnant women should be avoided because it can cause miscarriage and birth defects. Thiamine, that is vitamin B1 deficiency. Thiamine, named as the thiovitamine, that is sulfur containing vitamin, is a water soluble vitamin of the B complex. First named anurin for the determinal neurological effects, if not present in the diet, it was eventually assigned the generic descriptor name, that is vitamin B1. Its phosphate derivatives are involved in many cellular processes. The best characterized form is thiamine pyrophosphate, that is TPP, a coenzyme in the catabolism of sugars and amino acids. Thiamine is used in the biosynthesis of the neurotransmitter acetylcholine and gamma aminobutyric acid, that is GABA. In yeast, TPP is also required in the first step of alcoholic fermentation. All living organisms use thiamine in their biochemistry, but it is only synthesized in bacteria, fungi and plants. Animals obtain it from their diet and thus for them it is a vitamin. Insufficient intake in birds produces a characteristic polyneuritis and in mammals results in a disease called beriberi affecting the peripheral nervous system, that is polyneuritis, and the cardiovascular system with fatal outcome if not cured by thiamine administration. In less severe deficiency, non-specific signs include malaise, weight loss, irritability and confusion. Beriberi. Beriberi is a nervous system ailment caused by a thiamine deficiency in the diet. Thiamine is involved in the breakdown of molecules such as glucose and is also found on the membranes of neurons. Symptoms of beriberi include severe lethargy and fatigue, together with complications affecting the cardiovascular, nervous, muscular and gastrointestinal systems. Riboflavin, that is vitamin B2 deficiency. Vitamin B2 deficiency, also known as eriboflavinosis, is unlikely without the simultaneous deficiency of other nutrients. After several months of riboflavin deprivation, symptoms include cracks in the skin at the corners of the mouth, fissures of the lips and inflamed magenta colored tongue. Because riboflavin is readily destroyed by ultraviolet light, jaundiced infants who are treated with light therapy are administered the vitamin. Milk, milk products and cereals, major sources of riboflavin in the diet, are packaged to prevent exposure to light. Niacin, that is vitamin B3 deficiency. Niacin, also known as vitamin B3, nicotinic acid and vitamin PP, is an organic compound with the formula C6H5NO2 and is one of the most essential human nutrients. Niacin is one of the 5 vitamins associated with a pandemic deficiency disease, that is niacin deficiency called pellagra, vitamin C deficiency called scurvy, thiamine deficiency called beriberi, vitamin D deficiency called rickets and vitamin A deficiency called night blindness, including other symptoms. This colorless water soluble solid is a derivative of pyridine with a carboxyl group at the 3rd position. Other forms of vitamin B3 include the corresponding amide, nicotinamide, where the carboxyl group has been replaced by a carboxamide group, that is CONH2, as well as more complex amides and a variety of esters. The term niacin, nicotinamide and vitamin B3 are often used interchangeably to refer to any member of this family of compounds since they have similar biochemical activity. Severe deficiency of niacin in the diet causes the disease pellagra, which is characterized by diarrhea, dermatitis and dementia, as well as necklace lesions on the lower neck, hyperpigmentation, thickening of the skin, inflammation of the mouth and tongue, digestive disturbances, amnesia, delirium and eventually death if left untreated. Common psychiatric symptoms of niacin deficiency include irritability, poor concentration, anxiety, fatigue, restlessness, apathy and depression. Studies have indicated that in patients with alcoholic pellagra, niacin deficiency may be an important factor influencing both the onset and severity of this condition. Alcoholic patients typically experience increased intestinal permeability, leading to negative health outcomes. HARTNUP'S disease. HARTNUP'S disease is a hereditary nutritional disorder resulting in niacin deficiency. This condition was first identified in 1950s by the HARTNUP family in London. It is due to a deficit in the intestines and kidneys, making it difficult for the body to break down and absorb dietary tryptophan. The resulting condition is similar to pellagra, including symptom of red, scaly rash and sensitivity to sunlight. Oral niacin is given as a treatment for this condition in doses ranging from 40 to 200 mg with a good prognosis if identified and treated early. Niacin synthesis is also deficient in carcinoid syndrome because of metabolic diversion of its precursor tryptophan to form serotonin. Biotin. Deficiency of biotin is rare and this may be due in part to synthesis of the vitamin by bacteria in the colon, although the importance of this source is unclear. Biotin deficiency has been observed in people who regularly eat large quantities of raw egg white, which contains a glycoprotein called avidin that binds biotin and prevents its absorption. A rare genetic defect that renders some infants unable to absorb a form of biotin in food can be treated with a supplement of the vitamin. Long-term use of certain anticonvulsant drug may also impair biotin absorption. Symptoms of deficiency include skin rash, hair loss and eventually neurological abnormalities. Scurvy, that is vitamin C deficiency. Scurvy is a disease resulting from a deficiency of vitamin C, which is required for the synthesis of collagen in humans. The chemical name for vitamin C is ascorbic acid, which is derived from the Latin name of scurvy is scorbutus. Scurvy often presents itself initially as symptom of malaise and lethargy, followed by formation of spots on the skin, spongy gums and bleeding from the mucous membranes. Spots are most abundant on the thighs and legs, and a person with the ailment looks pale, feels depressed and is partially immobilized. As scurvy advances, there can be open suppurating wounds, loss of teeth, jaundice, fever, neuropathy and death. In infants, scurvy is sometimes referred to as Barlow's disease, named after Sir Thomas Barlow, a British physician who described it. Scurvy does not occur in most animals because they can synthesize their own vitamin C. However, humans and other higher primates, guinea pigs, most or all bats and some species of birds and fish lack an enzyme called L-gluconolactone oxidase necessary for such synthesis and must obtain vitamin C through their diet. Vitamin C is widespread in plant tissues with particularly high concentrations occurring in citrus fruits like oranges, lemons, limes and grapefruits as well as vegetables. Vitamin E deficiency. Vitamin E deficiency is rare in humans, although it may develop in premature infants and in people with impaired fat absorption or metabolism. In premature infants, fragility of red blood cells, that is hemolysis, is seen. In the people with impaired fat absorption or metabolism, the deficiency is more prolonged. Neuromuscular dysfunction involving the spinal cord and retina may result in loss of reflexes, impaired balance and coordination, muscle weakness and visual disturbances. No specific metabolic function has been established for vitamin E. However, it is an important part of the antioxidant system that inhibits lipid peroxidation that is, it protects cells and their membranes against the damaging effects of free radicals, that is reactive oxygen and nitrogen species that are produced metabolically or enter the body from the environment. The requirement for vitamin E is increased with increasing consumption of polyunsaturated fatty acids. People who smoke or are subjected to air pollution may also need more of the vitamin to protect against oxidative damage to the lungs. Vitamin K deficiency. Vitamin K is necessary for the formation of prothrombin and other blood clotting factors in the liver, and it also plays a role in bone metabolism. A form of the vitamin is produced by bacteria in the colon and can be utilized to some degree. Vitamin K deficiency causes impaired clotting of the blood and internal bleeding even without injury. Due to poor transport of vitamin K across the placenta, newborn infants in developed countries are routinely given the vitamin intramuscularly or orally within 6 hours of birth to protect against a condition known as hemorrhagic disease of the newborn, that is HDNB. Vitamin K deficiency is rare in the adults except in syndromes with poor fat absorption, in liver disease or during treatment with certain anticoagulant drugs which interfere with vitamin K metabolism. It becomes very much essential for the students to understand what we eat and what are the different nutrients that are required for our daily metabolic activity. A nutritional study helps us to understand the importance of the nutrients and how to prevent the occurrence of different diseases which are avoidable. One should include a proper daily diet in the meals they consume.